I had had a lump on my neck, which I was sort of ignoring. At any rate, went to the doctor. He says, you have lymphoma, probably slow growing, but we'll watch it. He said, but I think we should biopsy the node. And that's where they came up with the mantle cell, which was not slow moving. I was really shocked. I couldn't believe it. I felt great. The oncologist I was seeing at that time, he said, I don't feel I can treat this particular kind of cancer. He then looked into different clinical trials or different hospitals that were offering. He had Dr. Goodwin was a friend of his. He called him. Dr. Goodwin then recommended I see Dr. Lossos, who is really the main man for lymphoma. And he said to me, I just got the okay, the approval for a clinical trial, which I think will help you. And I was the first person in his clinical trial. So we played a lot of rearranging, doing things a little differently than he had anticipated, because although you have a certain protocol that you're using, not everybody is the same. It was very scary. You know what? It was very scary, but you know, somehow when you're the patient, you're sort of like not in the real sense of like what's really going to happen. And everybody else around me was like scurrying around, and they were worried, and not that I wasn't concerned, but I felt if it is what it is, I have faith, it's either I'm either going to get better or I'm going to die. You know, I mean, I don't have, not that I have any death wish, believe me. I have 3 kids, 5 grandchildren, great husband, at any rate. But after that first round, they didn't find any lymph nodes that were infected, and all my lymph nodes were affected by the cancer. So all of a sudden, he said, I think we're onto something here. I think it's going to be good. I think the best thing to do is not to panic right away. I mean, it's hard to say, but you know, you really do. You need to get your thoughts together and do as much investigating into that particular disease so that you know where you're going with it. You really somehow need to be your own advocate, as well as having other people help you out with it. But I think the biggest thing is not to panic, because there's a lot of people out there that are well and have cancer.